Hello, my name is Dr. Daryl Rich. I am the clinical director and owner of Core Chiropractic and Wellness in downtown Roanoke. I want to say thank you to the Huddle Up Moms group for allowing me this opportunity to share in this resource summit and to be able to share with you some thoughts on one of my most passionate topics, that's exercise during pregnancy. You know, I first started educating pregnant women about exercise as a student in chiropractic school, and I've continued to do this for the last 16 years in private practice. And it really is just one of my favorite groups to work with. Pregnant and postpartum women are just some of the most fun individuals to work with, and I just love it so much. So, of course, one of the most common questions that any practitioner gets on this kind of topic is it safe to exercise during pregnancy? Well, this simple question has a not so simple answer, and that is, well, it depends. You know, safety of any exercise for anyone during any time is, can you keep your body stable and in normal physiological limits while you're exercising? And of course, pregnancy has some unique things about it that make keeping the spine and the body stable during exercise a bit more difficult. Likewise, changes in heart rate and blood pressure and blood sugar during pregnancy, those can lead to complications with exercise. But I want you to know, as a whole, if you're doing an exercise before pregnancy, you're more than likely should be able to do it during pregnancy, at least until the stability begins to break down, or again, some of those physiological limits are being pushed. So remember that you're not fragile when you're pregnant. You know, you don't have a disease. You shouldn't be treated like an alien, but you do have some special considerations that we need to think about. And so I want to take some time during this seminar to highlight some of those special changes and some of those special considerations that we need to think about during pregnancy, and particularly the impact and how it affects our exercise. And we're going to look at this in really three parts. We're going to look at this through the core, the shoulders, and the hips. So the word core, that means a lot of things to a lot of people, and it can mean kind of the middle, the foundation, the center. But when we talk about it in terms of exercise terms, we often refer to it the area between the ribs and the pelvis. And it's surrounded by musculature in front and back, both sides, and actually above and below. The core is the middle of the body. It's the foundation for movement. It's the center of mass for the human frame. It's what provides stability and strength to the spine. And when it's strong enough, it will even prevent injury. Every motion we do during exercise, including walking, running, throwing, jumping, lifting, whatever, starts with stabilization of the spine and the core muscles. And this, of course, occurs when exercises are safe and they're purposeful. You have to have the core working in a really good way, even if you're just doing things around the house. So during pregnancy, this stabilization system is greatly challenged by the growing baby. The stabilization that occurs when the diaphragm pressurizes the lower abdomen pushes fluid down in the abdomen, and it has to be countered by the abdominal muscles in front and the pelvic floor underneath. Well, what happens, of course, during pregnancy is that these muscles start to become kind of weak, and they start to kind of naturally relax. And so if that diaphragm, if it doesn't have enough strength to push down, or it's not met by an equal force of the abs and the pelvic floor backwards, then you lose stability, and athletic performance can decline, or we can be ready for injury. So as the pregnant body is moving towards this instability, as the pelvic floor and the abdominals relax, this has a profound effect on posture, resulting in compensation patterns and general weakness. And this can, again, lead to complications during pregnancy that we just have to be careful with when we're trying to exercise. Again, these things can show up even as the pregnant walk or the pregnant waddle. So to demonstrate the impact of how the core has on stability and strength and how posture can affect this, I'm going to show you a little quick party trick that we call the iron handshake. So try this one. All right, so we have a fun little trick that we're going to show you that is going to kind of explain how core stabilization works. So we call this the iron handshake. And what we're going to do is we're going to have my two daughters here are going to stand with some bad posture, and they're going to try to squeeze the other one's hands. This is the sisters trying to take out some aggression against each other here. So Ellie, we'll let you go first. I'm going to let you stand kind of bad slumpy posture, shoulders kind of rounded, kind of the typical maybe pregnant kind of bad form. And I want you to shake Kaylin's hand, and I want you to go ahead and try to squeeze it as hard as you can with bad posture. Okay? All right, now Kaylin, same thing. Let's have you just kind of, crisscross your feet, maybe, stand with the hand on the hip, kind of bad there, and you try to squeeze now Ellie's hand as hard as you can. All right, so nobody's really turning colors yet. So now we're going to show the difference what happens when you actually use good posture. Remember, the diaphragm is what stabilizes the core, and you have to be in the right position for this to happen. So the diaphragm and the pelvic floor have to be pretty much parallel with each other. So what that's going to look like, and we do this kind of together, so we're going to put our feet about shoulder width apart, just like if you're in basketball, a little defensive stance, drop your tush down a little bit, stand really nice and tall. All right, go ahead and try to just hold each other. Don't shake hands yet. All right, we're going to let Ellie go first. Okay, you can grab hands. There you go. So Ellie's going to go first. So Ellie, what I want you to do is brace here really tight all the way around your core. All right, I want you to kind of give your feet kind of firmly into the ground, almost like you're ripping the floor apart. Take your left hand. I want you to squeeze really hard with your left hand, and with all your might, now give Kaylin a wicked handshake. 1, 2, 3, go. All right, a little bit better, Kaylin. Now you get to retaliate. Okay, so same thing, Kaylin. So again, feet shoulder width apart. Drop your tail down, nice and tall. Take your left hand. We're going to use this. So it happens when you actually use your left hand, you're actually trying to get the brain to what's called a feed forward mechanism. So it's actually going to train the right hand to give it a really hard squeeze. So we squeeze with the left hand really tight, really bear down, and then let her have it. Yeah, there you go, there you go. So try that one at home. It's a really neat, fun little trick, again, once you can find somebody in a non-COVID world to shake hands with. So take care. Well, I hope you got a chance to try that. It can be a fun way to surprise somebody when eventually we go back to shaking hands with people, if that ever happens again. So one thing I want to show you is kind of what happens, again, with the pregnant body. And it's actually, we can use our babies to kind of see what goes on. Early on in life, the first 4 months, the diaphragm isn't very well coordinated. And so breathing is also not very well coordinated. And then somewhere around after 4 months, the diaphragm starts to function a little bit better, stability, and it allows the baby to creep and to crawl and to roll over. And then as it gets a little bit stronger, kind of past 6 months, it allows eventually for us to get a little more upright, which allows us to stand and eventually, of course, to walk. And it's because the diaphragm functions to produce, again, this stability that is essential for all movement, and particularly complex tasks like exercise. So what happens if one of those muscles of the core, or if even just a part of the muscle, doesn't provide the correct stabilization needed for this purposeful movement? Well, dysfunction occurs. And this will cause a compensatory mechanism or a compensatory pattern that shows up, and that eventually leads to a trigger point in a muscle or even joint damage. Now, one major compensation that happens during pregnancy is that when the lumbar erector muscles become over-dominant over the anterior abdominal muscles. So the muscles in the back become stronger than the muscles in the front. And this produces what Pavel Kolash called the open scissor position. It's a non-ideal position of the rib cage, and it prevents effective pressurization of the abdomen by the diaphragm, and in turn leads to weakness in the core muscles, which can lead to injury, particularly with repetitive motions like forward bending. So think about it for a second. Like a pregnant mom who's going to pick up her 2-year-old throughout the day, if she does this multiple times, it can lead to a back injury. And obviously for anyone trying to exercise during pregnancy, this postural presentation can become a very large problem. They're going to end up with rope-like muscles in the back, also in the neck and the shoulders. And as they become overly worked and overly tight, they're going to produce stability problems, shoulder injuries, headaches, and it can be a lot of big problems. So exercises like crunches and sit-ups, toe to bar, or any other exercise that repetitively brings the knee to the chest or the chest to the knee, or likewise any repetitive forward bending exercise really needs to be avoided when the core cannot properly be stabilized. So what we're going to do is we're going to show you a few exercises that don't use those types of movements that will be helpful to reduce this open scissor compensation pattern and help the core to return back to normal function. And these exercises are great, an effective core routine by themselves. You can use them to reduce back pain or hip problems. It can be a great warm-up before a run or before weightlifting. And of course, it can also help you to learn how to brace through your lower core, which is important when you're going to be pushing through labor here soon. Hope you like these. This exercise is called the cat-camel, often called the cat-cow in some places. It's designed to produce stability and mobility of the spine. And basically what we're going to do is we're going to get on all fours just like this. We have our hands right underneath our shoulders, our knees right underneath our hips. And what we're trying to do is get movement throughout the entire spine. So what Ellie's going to do here, she's going to simply kind of arch her back up while she drops her chin down. And then she's going to reverse that, allowing her spine to go down, not too fast, and her chin up. And again, go back and forth, just nice and gentle with that. So she might repeat this anywhere between 15. Today I want to show you the side bridge exercise. This is probably the most complete core exercise that there is, as it works all of the muscles of the core while stabilizing the spine in a completely neutral position. So we begin this exercise. I'm going to show you this in progressions, and I'm going to show you the easiest to the most hard progression of this exercise. So simply on your side, knees bent and actually in front of you, hand on your top of your hip. This elbow is right underneath your shoulder. Don't have it out extended or in too close, just right underneath the shoulder. And from here, you're simply going to bridge the hips up and forward, hold it for a count of 5 to 7 seconds, and then right back down. And then again, up and forward, and right back down. And if you can manage that, the next progression is to take the knees and have them completely straight. So again, my knees are still bent, but my knees, hips, and shoulders are all in one straight line right now. And I'm going to simply bridge up this time and hold it again in between 5 to 7 seconds. If you can go a little bit longer, that's fine. I wouldn't go more than about 10 or 15 seconds, but anywhere between 7 to 10 is great. Now, if you can handle that, we can put the legs fully extended. Now we're making the true complete side bridge. I like my top foot to go on top or kind of in front of my bottom foot. And that way I can bridge all the way up. Again, hold it for anywhere between 6 to 7 seconds, or I can hold it as many as 10 as I like. And then back down. And as you come back down, just rest for a second or two, and then pop right back up. Great. So that's the side bridge exercise. Try that in sets of 2 to 3, and again, multiple repetitions. You can do that once or twice a day. I love to do this one before I go to bed. Just kind of gets me kind of, that's kind of when I do my home workout. But of course, it's a really great also pre-participation, kind of a warm-up exercise before any sport or any workout in the gym. So try that one. Today I'm going to show you the bird dog exercise. This is one of the top 3 exercises that we use for the core. Along with the side bridge and the curl up. This exercise is really fantastic for working to stabilize the entire core musculature and continue to keep that spine very neutral as we're moving the arms and the legs. So what we do in this exercise, we're simply going to go onto the floor, hands and knees, hands right underneath the shoulders, knees right underneath the hips. And the whole idea with this is, can I keep this core very stabilized? Can I brace through my lumbar spine so that I'm not rotating my pelvis as I'm moving my arms and my legs? So to begin with, I'm going to simply start keeping that neutral position. So I'm not flexed, I'm not extended, I'm just neutral with the spine. I'm going to brace, and can I slide my hand up and out and keep everything braced, and back down and go with the next one. Nice and easy. If I can do that, then I can try a leg. Again, just slide it out and slide it back. And again, the other side, slide it out and slide it back. Things to watch for, you don't want to be lifting with the hips. I don't want to rotate the hip as I'm doing this exercise. I simply want to slide it across the floor. If I can do those pretty successfully, then I want to add a little opposite leg, opposite arm. And so again, I'm going to hold this, I'm going to brace, and I'm going to slide out an opposite leg, opposite arm, and return it, and switch, and return, and switch. And so I'm just continuing to go through that alternating positions. If I can do those really well, there's one little trick that I like to do. This one's we call draw a box. So as I'm going to slide out, I'm going to hold that, and then from here I'm going to draw a box. I'm going to go out and down and back in and up and out and down and back in. And the key with that is, can I keep my spine very stable throughout that whole movement? Again, it's not so much what the arms and legs do, it's can you keep that core stabilized? So try that for sets of reps, somewhere between 8 to 15, do 2 to 3 sets with it. It should be a really great exercise for you. The 3-month supine position. It's a position that is very versatile and something that we use in our office for anything from our elderly patients to some of our more elite athletes. And so what we can do with this is we're going to bring Ellie into a position of challenges with her lower extremity and her upper extremity as a way of, can she be challenged to keep her core really stable? So the key is what we're looking for is, can she keep her rib cage really low, her back flat on the floor? Can she breathe through her lower abdomen while keeping it stabilized through her lower core? So we're going to put her in a position like this here to begin with, where her knees are bent at 90, her hips are at 90, and simply, can she just hold that? For a lot of you, that's as good as it's going to get for a while. This is be challenging enough. Your back's going to want to arch, you're going to lose that stability. So can you just simply do that? If you can, then we can advance it by little tweaks, okay? So one of the first tweaks we're going to do is simply, can you bring that leg down towards the floor and then return it back up into that starting position? And do that on both sides, obviously. If you're able to do that, then we can show it. We can do a different little hip position, and we can let one leg fall out to the side, and we can let it come back up. Again, it's not about what the legs are doing, it's about what the core is doing. Can the core stay stabilized? Kind of think about picking up a box. Can you pick up a box? The hips have to move, but the core has to stay stabilized throughout, or else you're going to hurt your back. And that's kind of what this exercise can help to train. All right, if we can do that, then we can advance to something with the upper extremity. So we put her back in that same position, so the 90-90 position, and now we're going to bring her hands up towards the sky, spreading her fingers out really wide. In this position, now we're going to let her legs go back and do the challenge towards the floor and coming right back up. Again, always staying stabilized, never letting the low back arch. Great. If you can handle that, then we can let the upper extremities move. We'll let one arm go overhead. Again, a way of kind of challenging the core by making the upper extremity do something. Perfect. If she passes that, we could go on to combining the two, and this is kind of a dead bug kind of position is what we use. So again, the hands are back in that position, hips and knees. We're going to do alternating positions of the legs and the arms. Good. All about, again, keeping this very stabilized. The trick with this is to move slow. Don't move too fast, okay? Concentrate on your breathing, concentrate on your stabilization. Keep that position maintained at all times. If you start to fatigue, just stop, put everything down, just relax, and just take a little break, let those core muscles kind of regroup before you move on to the next one. All right, now, if they can handle this, now we can add a little bit of resistance training. So what we can do is, back in that kind of same position, is we can actually take some TheraBands, we can wrap it around the knees, we can put some TheraBands around the arms. We can actually connect them so we give a little bit of resistance as we move the arms and legs. If you're in the gym, you can be in this same position here, but you can use pulleys to give the upper body, again, a bit of a challenge. There's a lot of variations with this. Again, it's not about what the appendage is doing. It's not about what the weight you're lifting or the band or what it's doing. It's about how can you challenge the body to maintain that core stabilization. So what we're going to do in Ellie's case here, we're actually going to give her this heavy kettlebell. We could also give her a medicine ball, and can she hold that while she's maintaining that stability and moving her legs? So again, back to the 90-90 position, arms straight up, fingers spread. We'll give her this heavy kettlebell. Can she hold it? Excellent. And now we're going to let this leg go back out and come right back up. And can we switch it? Excellent. Again, all about stabilization. If she can do that, you can do the other variation with the hips, or she could even try taking this kettlebell up and over her head in kind of a skull crusher. This one would crush her skull, so we're going to let her do that one this time. But it's a really great exercise, again, for the shoulders. Again, this is called the 3-month supine position. Watch for some of our other videos as we take this and we advance it even a little bit further steps. So to summarize, the core is the most important functional group of all the muscles in the body. It's the first muscle group to contract and to stabilize for nearly every movement. And the more load and demand that's necessary, the more the core is needed to stabilize the spine. The position of the rib cage in relation to the pelvis is essential for creating this stabilization and preventing injury and, of course, spine degeneration. So now we're going to turn our attention to the shoulders. You know, pregnancy does a number on posture. It's most evident probably at the shoulders. As we lose stability in the core during pregnancy, the compensation pattern creates tightness in the pecs and traps of the shoulders, and what creates also stiffness in the upper back. And it kind of creates this over-rounded shoulder position. You know, every mobility issue, tight muscle or even a stuck joint, is really an underlying stability issue. And even just one muscle or just a part of that muscle is dysfunctional, the whole stabilizing function and movement is going to be compromised. And that's why we need to be careful when we're exercising the upper body when we have a woman who's pregnant. The instability here just can create too much problems for the shoulder, neck, and back. And so we need to avoid certain exercises, particularly like weight machines. During pregnancy, most of these machines will overload the shoulders. Also exercises like bench press or military press, shrugs. They should be avoided by most people as well, but particularly pregnant women, because they reinforce this rolled shoulder compensation pattern. So instead, we're going to turn to exercises that help to open up the shoulders and ones that are going to help to mobilize the upper T-spine, the upper thoracic spine. And so we're going to show you now a few of these exercises that can be helpful to reduce that compensation pattern. And again, they can be used as a standalone routine or as a warm-up before a more intense workout. So I hope you enjoy these. This exercise is called the tripod thoracic rotation exercise, and it's designed to help improve the movement between the shoulder blades. Often as we age, we have a tendency to get really stuck and stiff in the shoulders and can get kind of rounded posture, and this exercise is actually helpful to reduce that. It's also really great for anybody who is a baseball pitcher, throwing athlete, football player, or even a racket sport athlete, as it helps to keep that motion through the shoulders that's so important for any type of throwing athlete or, again, racket sport athlete. So what we do is we start in the tripod position. So we're going to bring one foot all the way up. So you kind of see her hip is at 90 or knees at 90. We got two hands on the ground, and the outside arm is going to come up. But before she starts, I'm going to really kind of recorrect this, and I want her spine to be really level. We're trying not to round through that spine, keeping the core stabilized really low. So now we're going to move right through the upper back, try to keep the hips pretty well stable, and kind of follow it with your nose. Good. And bring it all the way back down and through to the other side. Excellent. So with each movement, as we get to the top, we're trying to kind of open up those shoulders, really separate each shoulder from each other to really broaden or kind of get out of that hunchback position that so many people find themselves in. Exercise is similar to our tripod thoracic rotation exercise, but we're going to do this one in the bear position. It's kind of a little bit more advanced, but it also gets the core a little bit better. So it's a really great exercise, again, particularly for throwing athletes and for people who are getting stiff between their shoulders as they age. So what we're going to do is we're going to have Ellie here come up in the bear position. So you kind of see her knees are slightly bent, feet are about shoulder width apart, or even just a little bit wider than shoulder width apart. And again, the key here is to kind of keep the thoracic spine very flat to where she's really stabilized through her core. And that's where she's going to really kind of focus in on is, can she keep this area really stable? And what we're going to do is we're going to let one side, and you can either arm, but we're going to let this arm come all the way out. She's going to follow that with her nose as she's watching it, and then bring it all the way through and under her other leg, or other arm. As she goes back up, again, nice and slow. Try not to get too much rotation in the hips. Try to keep it mostly through the upper back. Again, this is a great exercise for anybody who really uses their shoulders quite a bit. If you're trying to kind of stave off the stiffness that we get in the upper back, particularly from working at a computer quite a bit, this is a really great exercise for that.
An active shoulder stretch can be done on the wall to great effect in improving the shoulder mobility. Start by simply going straight up the wall and then change angles with each step. Each time, step back with your opposing foot and lunge into the wall. This way you improve not just the shoulder motion, but thoracic spine extension. The Windshield Wiper exercise is a rotator cuff strengthening exercise. Simply perform a plank-like position on the wall and move your arms in a circular fashion up and down the arm, keeping tension on the TheraBand at all times. For the side plank roll, hold the side plank position and move the body as one unit. Hips and shoulders move at the exact same time.
So when there's a lack of core strength, the entire body can suffer due to the breakdown of stability through the entire kinematic chain. So as we turn our attention to the hips, the common dysfunctions related to a weak core are things like hip instability, hip pain, hip bursitis, lumbopelvic instability, piriformis syndrome, increased disc pressure or like a bulging disc, knee pain, and pelvic floor weakness. So by improving the core stabilization and hip mobility, we can reduce these problems and we can continue to keep the body stable throughout pregnancy. So here are a few more exercises to help improve the hip, which should allow you to walk or run or weight lift or just get around better during the late stages of pregnancy. I hope you like them. Hi, today I'm going to show you the lunge stretch, which is my favorite hip flexor stretch. Hip flexors are the muscles that are found on the anterior side of the hip, and when you sit a lot or you drive a lot or you sleep in the fetal position, these muscles can become chronically fibrotic and can produce chronic low back pain. So this stretch is one of my very most favorites that I like the best. We're going to put one knee straight down. We're going to put one leg out in front of you. And from here, you're going to stand really, really tall, and you're going to take your hips and you're going to push them directly into the floor, keeping your back very straight. If I bend forward, I lose the stretch. I'm trying to extend through the spine and the hip as I drive my hips forward and hold it for a couple of seconds. And I can back it off. I can pick this leg out a little bit further, and I can go into it again. Again, driving my hips directly into the floor. If I want to do a little extra, I can take one hand up and over and get a little bit of lateral bending through the spine, and that will enhance that stretch just a little bit. Try that on each side several times a day, particularly after you've been riding in the car or if you've been sitting for longer than 30 minutes or so at your desk. This lunge stretch is wonderful for your low back pain. This is called the hip hinge. And it's a really great exercise to develop good mobility in the hips that we often get very stiff at. So in this position, kind of the all fours position, what we're going to do is we're going to let her hips just simply slide back, leaving her arms in place, kind of down in almost like a prayer position as in yoga sometimes, and then come right back up. Great. And then right back down. And this is a great variation to kind of open up through not just the hips, but also through the lats and the upper back. And then there's another variation we're going to do here. So now Ellie's going to come back and now sit straight up, nice and tall, hands upright, in good posture. So what we'll do is we'll bring her hands up like this, perfect. And now just, she's going to come up right off of her knees, and again, just hinging right through the hips and right back down. Good, and right back up. Good, right back down. And back up. And again, multiple repetitions, somewhere between 10 to. So this exercise is called the Oblique Sit, and what we're going to do is we're going to put one leg out in front and just kind of open up the hip just a little bit. So just bring it a little bit out to the outside. The back leg is going to go inward just a little bit. Hands are going to be up in front, thumbs up, fingers spread, and a little slight turn. Now from here, what we're going to do is we're going to slide back and down, and then back up through that hip. Good, good, good. And right back down. And so what we're working on is, again, mobility here in the hip, strength in the knee. The things that we need most, as far as particularly as we age, is strength in those quad muscles to keep good, healthy knees and good, healthy hips. One more time. Great. Hi. This exercise is called the clock lunge. The clock lunge is one of my most prescribed exercises because it's a way of helping to groove a new motor pattern, which is really important as we're trying to help somebody come back from an injury in their low back, their hip, or their knee. And after somebody's been working on relaxing or stretching their hip flexors, you need this exercise to help retrain and kind of, again, regroove some of the motor patterns that come with chronically tight muscles. So to do this exercise, we pretend like we're standing on a clock. 12 o'clock can be straight in front of us. And I'm going to simply start by lunging out to 2 o'clock. Now in this lunge, my hips and my shoulders and my eyes are going in the direction of 2 o'clock, and then I return. So my back leg is staying at 12. I'm going to open up and go to 2, and then I'm going to return. Now to make this harder, we simply step out further. So as my legs and hip flexors and groin all loosen up, I can take a really wide lunge, and again, I'm moving everything in that direction. So that's 2 o'clock on the dial. If I'm going to turn to 10 o'clock, I'm going to step with my left foot, and again, move in that same direction. My right foot stays pointing at 12, and I return. And we just keep kind of grooving that pattern until the hip flexor and the groin and the hip really opens up and begins to become very flexible. Now, 2 o'clock and 10 o'clock, we can also go to 4 and 8. So to do that, I'm simply going to stand again facing 12, and I'm going to pivot and go to 8 o'clock and move in that direction. Again, my hips, my shoulders, my eyes are all looking in that direction as I move towards it. Good. And then I can do the same thing to 4 o'clock. Now, if you notice, one thing we're not doing is we're never crossing midline. So I'm never bringing my right foot and crossing it over to go to 10 o'clock. I'm always working on opening up my hips. Again, loosening up the hip flexor and the groin as I move. That's the clock lunge. Perform each position anywhere between 7 to 15 times. You can do this multiple times a day, after you've been sitting, after you've been driving, and particularly before a workout or for a run. This is a great warm-up exercise. Hey, I just want to say thank you so much for spending your time with us during this exercise and pregnancy seminar. We also want to say thank you so much to the Huddle Up's Moms Group and putting on this wonderful resource summit. You know, if I can encourage you to do one thing, that is simply during your pregnancy, really strive to keep your body as healthy as possible. And one part of that is I would encourage you to include a chiropractor into that group. You know, a chiropractor can be one great piece of that puzzle of your healthcare team that you're putting together. And it can just be an integral part of that again, network of professionals that you're putting together. And we can work great with your obstetricians, your midwives, and whoever else is just on your medical team. So I encourage you just to find a good chiropractor, a doctor you trust, a doctor that you can rely upon just for good advice. And there's plenty of doctors around the area, wherever you're at. Of course, if you need one, we would love to be that doctor for you. You can find us at coreroanoke.com. We're also on Facebook and Instagram at Core Roanoke as well. And again, we just want to say thank you so much for spending your time with us. If you have any questions at all, please reach out to us. We'd love to help you any way we can.